One of the objectives of the Watoto Wetu project is working with county governments towards ending FGM, child marriages, and other harmful cultural practices. In October 2020, EachRights, in partnership with the Standard Media Group, carried out the Tunza Watoto Wetu media campaign. The campaign focused on the effect of the COVID-19 pandemic on child rights violations, namely teenage pregnancies, child marriage, and female genital mutilation in Kajiado and Homa Bay counties.
Well, Kajiado County has been having the challenges of teenage pregnancy and, among others, the FGM. And all this has been seen rising because of the COVID issues that has come. The number of teenage pregnancy in Kajiado has rose actually to around 5,000, which has not been something very pleasant to the leaders in Kajiado and even to the parents in Kajiado. So we have also noticed that a number of children have undergone some FGM, which is not a nice thing that we want to see in Kajiado County. And we as leaders and various stakeholders, we are here and we are supporting many people advocating for the future of the children.
There are underlying causes to this, and one of them is poverty. Parental kind of negligence, poor parenting. These children have not been mentored properly. Our parents are avoiding to induct the children, talk to them about their sexuality, the fact that there are physiological changes that are taking place. So what happens is that our girls have been left to peers and other persons like the border who take advantage of them and lure them to the vice. But what I want to note is that with the pandemic that set into the country around April, the numbers are unlikely to go high. The statistics we are getting are statistics that happened before COVID. There are huge challenges. I want to say. There is a huge lack of cooperation from parents and guardians. Out of the 16 cases in court that were recorded from the beginning of the year, we have had less than 3 convictions. Why? Because there is a lot of corruption and the parents collude with the perpetrators, and the victims disappear. The parents also disappear. That's why we cannot be able to trace them. So that is a real challenge.
Just like adults, children are entitled to all the rights that are protected in our Constitution. And part of the rights that children have, and here I'm specifically talking about children of reproductive age. Reproductive age begins at the age of about 12. The Ministry of Health has done research and confirmed that actually a sexual debut in this country in some places, for some children, it's as low as 11 years of age. It therefore means that from the age of about 11 heading to 12, children are now cognizant of their reproductive abilities, their evolving reproductive capacities, and therefore, as part of their growth, they will get involved, including in sexual intercourse. What is missing and what is not strongly emphasized in the whole of this discussion is that why are we having a challenge with children in their reproductive cycle development? The root answer lies in whether we are providing young people, children and adolescents, with sufficient information. And this goes back to the tug of war that has existed in this country for a while. We have denied young people, we have denied children access to comprehensive sexuality education, both in and out of school.
first and foremost, we have empowered men themselves. We thought like in Kajiado, the issue about teenage pregnancy is all about girls. But we thought if we go to the root of everything, then probably men will take it and understand that whatever the girls are going through, it's so much for them, and now we need them as men of the society and the leaders of the society to come and take the lead. The gender-based violence in this case will also include the FGM, and once a man says no, it is no, and definitely being a leader, many people will be able to listen to them. So in Kajiado, we have empowered a number of men, roughly around 40, who we took them into training and had to tell them what we expect of them. We expect them to go out there, talk to their fellow men, and reach out so that at least when they agree to these issues, our girls and our mothers will be safe at home.
In Homa Bay, we are blessed with so many organizations, and we are very active in what we refer to as the Children's Assembly. There is that body where we have children leaders from all over the county. Every sub-county is represented, around 40 of them. We meet after every 3 months, and in those 3 months, we meet for 3 days. And in the 3 days, there are so many things we teach these children, their rights, how they are supposed to report, where, and what they should be able to do. In most of those conferences, we have teachers who accompany these children as chaperones. So these chaperones are also act as mentors, as well as people who can be able to relay information, people who can be able to sensitize the officers of the Ministry of Education and their fellow teachers about these children and how the plight of these children can be cascaded from the family setting to the other people. So that one has helped, because so many things come up through those assemblies, and the children speak up. And we've had cases where parents have been jailed, especially those who have defiled their own children.
What we are advocating for as a network is that we should not use cases of pregnancy to deny our girls access to quality services. One of them being education, another related services. One, what we are really focusing on is working with various stakeholders to enforce implementation of the school re-entry policy, which gives an avenue for all the girls who in one way or the other might have fallen back as a result of pregnancy. Then the policy is very clear that these girls, upon them having delivered, they are supposed to be able to get back to school. And that's one thing that we are picking up with it, just that despite the condition of the girls, they should not be denied the opportunity to get back to school.